Good morning, everybody. Welcome to the Fall Medic Michigan Emergency Department Improvement Collaborative-wide meeting. We're very happy you're here. We have a really exciting program for you today, and we're going to take care of a few details up front. First of all, disclosures. I think we all know Dr. Keith Coker has funding from the Sampson MDHHS for his state opioid work, now in over 20 Michigan emergency departments distributing naloxone kits. The rest of the members of the coordinating center, including myself, have nothing to disclose. The agenda today is really going to focus on a topic that was really ignited in the last about 18 months on health inequities and specifically within emergency department lens. I'm going to do the usual and traditional overview of where we stand in all of our measures. And then Andy is going to take it over with the planning for the 2022 target setting for P4P and VBR on all of our quality improvement measures. Then we're going to launch into our special guest speaker. And I want to just give a shout out to the Henry Ford group because several of their faculty were instrumental in making these links. Seth Krupp and Martina Caldwell, and Dr. Jonay Caldoun is going to be our guest speaker today. I'll go into more details. She's an outstanding and well-recognized leader in our state and now the nation. We're going to take a coffee break about 10:45, and then Keith is going to take us through the afternoon up until noon, and we're going to go into a little bit deeper dive and more health inequities with our summer interns, and we'll reintroduce them to you in that time frame. And then we're going to let Allison Stone, our data manager, really try to talk a little bit more about this transition to our research and our new Medic Link and Tableau reporting updates. So there's a lot going on behind the scenes. I know you're all busy logging on and taking advantage of this new platform, and we're going to go over a couple highlights from that work. And then at the end, we'll close out with our usual surveys. I just want to take a moment at this time to remind everybody this is a confidential meeting. Some of the information you are going to see is confidential, so there is no screenshots with cell phones and no sharing of this information. And by registering for this meeting, you acknowledge that responsibility. Thank you. Just some ground rules. We've already had and noticed people talking in the chat. Please do not use the chat. If you're a member of this meeting, the best way to communicate with us is through the Q&A box. We promise throughout the session after each speaker, there will be a time for question and answers, but you feel free to put them in. We want this to be open to you to engage with us. And so put your questions in at any point, and we will have someone in the background here. I'm in a room in the Michigan League vetting those questions, and we'll make sure the speaker gets them. Whatever we cannot get to during the meeting, we promise we will answer and get them to you after the meeting. So thank you for that. Just remember, this is CME endorsed, so that we have QR codes. We'll remind you again at the end of the meeting. Make sure to capture that for yourself, and it does expire in 6 months. There'll be another slide, and you will get the slide deck at the end of the meeting also emailed to you. We can't be better unless we hear from you. So remember, every time we have one of these meetings, there is a survey that you will receive within 24 hours after the meeting. Very important to fill those out. We can't get better or plan better without getting some of that feedback from you. So please, by all means, let us know what you think. I want to just put in a plug. Medic is growing. We'll see a little bit of evidence for that later in the meeting, but we do have a job posting to assist Allison Stone, our data manager, and to work closely with Arbor Research and our registry. This is our job posting. Andy Scott, our project manager, will be emailing all contacts at each site just to let you know what we're looking for. Feel free to click on that if you know anybody interested. We'd love to hear from you. I want to give a big shout out to all of our stakeholders in Medic who are publishing, and especially several of these folks here from a variety of hospitals within the consortium: Children's Hospital of Michigan, Raj Arora, Aaron Brennan from DMC Sinai Grace, Rob Nolans from Spectrum Health, Dave Soman from Michigan Medicine, my colleagues, Kathy Lee and Ben Basson at University of Michigan, of course, Keith and myself. We really try to give you some acknowledgement if you are busy publishing, and specifically if you have any work that is related to Medic, please let us know. We want to share it, so don't be shy. So with that, we just want to kick off a little bit about how we're doing. This is the highest level dashboard that we have. This is year-over-year performance on each of our quality measures. And each row gives you a little bit of information on which trend is better, so going up versus going down. So the adult head injury is appropriateness measure. We want CT scans to be used appropriately, so we want more of those to be done. You'll notice that over time, the numbers are in the 50% range. Please remember that 2020 was a bit of a special case due to the pandemic. So there was much less data in the part of the year that we did look at. So those numbers are a little bit different than usual trends. And then 2021 represents only data up until the end of June. So it's very important that there is about a 3-month data lag. So these numbers could change a bit. And as you see with the adult minor head injury appropriateness, we're at 53.8%, minor head injury CT overuse, 8.1%. The minor head injury intermediate CT use is at 22%. And the adult CT suspected PE diagnostic yield is at 8.8%. Chest X-ray use is dwindling in the wrong direction at 33.8%. And then our measures that relate to admissions, pediatric asthma and adult low-risk chest pain, where we're trying to reduce the number of people being admitted when it's safe to do so. Again, those numbers both are up is better, and they're at the 77 and 91 percentile. I just bring this up because as you can see that this includes all data from every hospital. It's a little difficult to see more detailed trends specifically at your hospital. So it's important for clinical champions to kind of understand their contributions to this. But we're going to go over a little bit more detail at the cohort level in a minute. So one notation, and I know that the clinical champions know this, but I wanted to share the collaborative. We did change, refine the pediatric safe discharge asthma measure just a bit after getting some feedback from those who are involved in it, specifically our 2 children's hospitals, DeVos Children's Hospital and Children's Hospital of Michigan. But remember, all sites have these reports in their tableau. So it is important to understand that we're trying to fix this at all hospitals, not just these, but these 2 sites are spearheading these changes. And what we decided to do was implement a process measure rather than the raw discharge measure, only because it makes more sense to the clinicians providing care. And that process measure is going to be timely administration of steroids within 60 minutes from the time of arrival of a patient. So it's only for children with a known diagnosis of asthma who arrive and actually do get steroids in the ED and looking at the time that they got them. So children who receive steroids before the arrival to the ED will not be in this measure. So as I promised, we're just going to look this very carefully from a cohort level. It gives you a little bit better lens on which to see where we're trending and if there are groups of EDs that maybe could use some refinement in their approach to improvement. This is the adult minor head injury CT appropriateness measure, where the number should be going in the upward direction, and you see a gentle slope upward in most trends for most cohorts. The top table will tell you all of the different cohorts and their year-over-year performance and raw numbers, and as these cohorts come on in various years. And as expected, you would imagine a lot of the newer cohorts take a little bit of time, but they do influence the overall collaborative-wide performance, as you saw in that first slide. So from a pediatric minor head injury, intermediate risk, you see a little bit more of a mixed picture when you look at this information by cohort, where you have gentle trending downward, which is the direction that we want this measure to be moving in, whereas some groups of hospitals are trending in the upward direction. Again, it's helpful to see this data in this particular way. Some of these hospitals can take a look at those hospitals that are performing well and reach out. Remember, one of our overall goals is to shorten the time to improvement by recognizing leaders who are doing well in these measures. The adult CTs for suspected PE diagnostic yield measure, again, the trend should be upward. You see a tighter framework of when you look at this information from a cohort standpoint, and a little bit of mix as well, whereas some are doing a little bit better than others. But again, those tend to be newer cohorts just coming on. PE is something of importance in most adult emergency departments. So this is definitely something that people care about. Pediatric respiratory illnesses, chest x-ray, where we want to decrease the utilization of chest x-rays for simple problems like asthma, croup, and bronchiolitis and in hospitals throughout Medic. Again, we want these trends to be downward, and overall we are seeing that with newer cohorts coming on with less of an impact. Not every site is being measured on chest x-ray, but there are definitely a few. So we wanted to give you some insight into just the overall impact that Medic is having throughout Michigan. And specifically, at this point, we now have over 500 Michigan emergency physicians who are looking at their data in the dashboard. And about 400 of those emergency department physicians are now VBR eligible. That's a significant financial impact. Since January 2020, my colleagues, I work with Andy Scott and Christy Radden heavily on the recruitment, and I just want to make sure it's clear to everyone in the collaborative, we essentially have doubled the size of our collaborative in the last year. So growing from now 26 to 46 EDs. These now represent over 10 health systems in the state of Michigan. Our abstractor training team, Carrie Smith and Katie Guarnaccia, have actively been training abstractors that have come along with all these new sites. We now have 24 new abstractors trained in 2020 and 44 total abstractors within the collaborative across all our sites. And most importantly, we have over 5.5 million encounters in the registry at this point. This is a substantial increase in data that we now have in our VIN that we can really learn from. So I want to give everybody a heads up just quickly on our VBR and P4P, where we stand. The two measures that we chose for VBR were CT scan appropriate for both adults and children. So here's the adult minor head injury appropriateness measure. You can see we are in the green so far with incomplete data into 2021, where our target is greater than or equal to 55%, and we stand at 61%. On the pediatric measure, we are right at the money at our target at less than or equal to 18%, and we were right there. So although I know there's a 3-month lag, and that data is already, working its way to the dashboard, we still have October because we are so close. I am really giving a shout out to all of our sites to really do whatever you can to try to get at this measure in October, where it will still count for this year. Again, P4P, collaborative-wide P4P measures, also the CT appropriateness. And remember, our trend, our 21 trend right now is at 55.8%, where the target is greater than or equal to 55%. So we are right there. And again, the pediatric intermediate head injury cases, we now stand at 17.4%. Again, hedging right on our target of greater than or equal to 18%. So if there's one word that I can give everybody in the collaborative, is that please keep your nose to the grind on both of these measures so that we can get VBR. Just a final measure, remember this year, we decided to, Blue Cross Blue Shield added the extra 2% VBR, and we are in the middle of that, where individual physicians have logged into the website and gotten a login procedure, and then they will fill out a secondary survey to tell us about their actual performance on a chosen measure. And that second survey is coming to each of you in October, and it is due back to us completed November 12th. So it's very important to keep those dates in mind for that extra 2%. So with that, I'll take questions if there are any. None?